Movements that occur at synovial joints are quite diverse based on the specific motion. And there's four types of motion that we need to consider. The first one is gliding motion. The next one is angular motion, then rotation, and finally special movements that really don't fit into other categories. The gliding motion is when there are specifically articular surfaces that slide back and forth or side to side. And the angle between the two bones does not change. So the best example of this would be between the carpal joints. Also, between the tarsal joints would be another example. The second type of movement is angular movement, where an angle is going to increase or decrease the angle between the two bones. So the first example is flexion, and flexion is when a joint angle is decreased. The opposite of flexion is extension, and in this case, the angle is going to be increased. Extending beyond the normal plane would be called hyperextension, and this is beyond the normal range of motion. Then there is lateral flexion, where the body trunk moves laterally in a coronal plane. Then we have abduction and adduction. Some physical therapists tend to say abduction so as not to confuse abduction with adduction, because they do sound pretty similar. Abduction or abduction would be body when there's movement of a body part away from the midline. So taking away an arm from the body. The opposite of this is adduction. So it would be the opposite where there is medial movement of a body part towards the midline. The last one on this slide is circumduction, where the proximal end of the bone stays stationary, but the distal portion of the bone makes a circular or a cone shape. So examples of this would be in the shoulder joint specifically. So on this slide, we can see an example of flexion of the head, and the opposite would be extension, and beyond that would be hyperextension. But there can be flexion and extension that happens at multiple joints. For the elbow joint, when we flex our biceps brachii, that's called flexion, decreases the angle between the two bones, whereas the opposite, primarily from the triceps, would be extension, increasing the angle between two bones. We also see flexion and extension here at the carpal joint. So flexion would be decreasing the angle here, whereas extension would be increasing the angle. We also see flexion and extension at the knee joint. This person is lifting up the crural region of their leg to decrease the angle at the knee joint at the popliteal region, whereas extension would be bringing the lower leg back down, thus increasing the angle at the knee joint. So the flexion and extension is all about the movement pertaining to that one specific joint. Lateral flexion is most often occurring when a person is leaning to their left or right. So they're decreasing the angle at the hip joint. So imagine she's standing straight up, but when she leans to the side, she is decreasing the angle. So that's called lateral flexion. Abduction or abduction is taking a limb away from the body, and it commonly happens with the shoulder joint and the hip joint. So this would be abduction, to take away. Bringing the limb back to her side would be adduction. For the lower leg here, To take away the leg from the midline of the body would be abduction, abduction, and to return it to its original position would be adduction. On this next slide, we see an example of abduction occurring at the wrist, but this is in a different plane than what we saw previously. So abduction would be taking it away from correct anatomical position, and adduction would be returning it to correct anatomical position. Adduction would be adding one digit to another, or abduction, rather, taking it away, excuse me. And adduction would be returning that digit back to normal. So this would be abduction, spreading the fingers. Adduction would be returning the fingers back so that they are together. Other examples of abduction and adduction, where there is extra movement, not just abduction and adduction, would be circumduction. Circumduction is basically the combination of several of the movements we've already talked about, like flexion, extension occurs, abduction, adduction occurs. So we're moving in multiple planes. So for that reason, it's called circumduction. And the circumduction can occur at the shoulder joint. It can also occur at the hip joint. So it's essentially making a cone or a circle in this case, something maybe a ballet dancer would do with the distal end of the lower limb. And again, up here with the upper limb, she is making a conical movement or a cone movement with the upper arm. Another group of movement that occurs at synovial joints is rotation, where the bone turns on its own longitudinal axis. One joint that you've already heard about is the atlantoaxial joint, and it involves turning the head along a pivot joint so that it can make a no gesture back and forth. Limbs that can turn to and from the median plane include the example of lateral rotation, rotating the limb laterally. Medially rotating would be the opposite of that. Then there is pronation and supination. You've already learned about pronation. It would be medial rotation of the forearm so that the palm turns inferiorly or posteriorly. I always like to tell students it's almost like with your hand, if you're making a claw with it, supination would be almost like you were making a bowl of soup with it, turning it in the opposite direction. These are examples of rotational movement rotation at the atlantoaxial joint, lateral rotation of the humerus at the shoulder, and the opposite, which would be medial rotation. In lateral rotation of the lower limb, she is turning her foot outward, and the opposite would be medial rotation, turning the foot back inward. And this is showing pronation and supination. Supination is where the radius and the ulna are parallel. Pronation, they cross over each other to form an X. Finally, there are examples of special movements. Some of these involve depression and elevation, and they're always in pairs, which makes it a little easier to learn. Then there's dorsiflexion and plantar flexion. These involve the foot inversion, eversion, protraction, retraction, and opposition and reposition. So we can see those shown on this slide. This person is depressing their head. They're pulling it downward, whereas elevation would be the opposite of this. In this case, they're elevating their shoulders. Dorsiflexion is moving the front of the foot, pointing the toes to the ceiling, And plantar flexion would be the function of the gastrocnemius, which would be standing on your tiptoes. Other special movements involve inversion and eversion. Inversion is raising the medial side of your foot. Eversion is just the opposite of that. Protraction is bringing the chin forward in this case. Retraction is pulling the chin backwards. Opposition is as simple as bringing the thumb to an opposite digit, which we see in this case.